But I think people would love to know, you're a little bit, just a few minutes on your journey, and then how you're into the space now where you really identified inflammation as this root cause for disease, and how you've made that the focus of your practice, and
Sure.
also, of course, your books.
Yeah, absolutely. So, my heart, my passion is functional medicine. It's people. So, for the past 12 years at this point, my day job hasn't changed. I spend 8 a.m. to 6 p.m. I'm at the Functional Medicine Center. We have been one of the first telehealth clinics for the past 12 years. So, I've done nothing but online webcam consults for my
Mm-hmm.
whole career. So now, obviously, in the time that we're living in, it's more of like a common thing, but it's not new for us as a clinic here. So we've been talking to people online for a long time about different health problems, different inflammatory health issues. Uh, my main patient base are people struggling with autoimmunity,
Mm-hmm.
uh, or people somewhere on this autoimmune inflammation spectrum that I
Yeah.
talk a lot about and write about, where these are complex issues. These are not quick
Right.
fix issues. These are complex variables, especially if somebody's thrown in overnight or thrown in a very short period of time and having to figure out all this stuff out of how to live with autoimmunity or how to live with some chronic illness. My job is to shed light on that path and to hold their hand through that path and to be alongside them with this on this path of
Mm-hmm.
finding out what are the root components of why they're struggling with their health issues. So we run labs and we drop ship labs wherever they're at in the world. And then we have guidance through that time to really get those labs looking great, which those labs are a reflection of why they feel the way that they do. So
Right.
that's really what my focus is. And my books are just a natural extension of that, of seeing how to
Absolutely.
utilize functional medicine, use food as medicine, and clinical nutrition in a very targeted way for people. So how I came into this, I've always loved wellness. And I grew up in a home that was interested in health and wellness, but so I was the weird kid drinking adaptogenic tonics in like the 80s and 90s before
I
it
love
was like
it.
a cool thing. But
Uh-huh.
then that evolved into me wanting to be formally trained in this, and then writing about it and speaking about it and talking about it, all that stuff. So that's really how it all began. It began a long time ago, but then
Mm-hmm.
over the years, I just got into it.
Hmm. I mean, so truly, you're like a visionary. I mean, you're one of the forefathers of this. You've been doing this for so long. But you were at, I think, a symposium recently, and you were saying that this is the age of inflammation. And I know what that
Hmm.
means, but can you explain to our audience, like, what
Mm-hmm.
does that mean, and how can you explain so that they better understand what's going on with them and why they're having the health issues that they're having that are so chronic?
Yeah, that's a good question. So inflammation is a nebulous term, I think, for many people that aren't in wellness. Like they kind of abstractly know what it is, but
Right.
they think maybe of like swollen joint, or maybe a migraine, or some aches and pains in the muscles. That is true. That's all inflammatory. But what we're talking about is typically chronic inflammation. And inflammation is a product of the immune system, so it's not
Mm-hmm.
inherently bad. It's actually quite important for our existence. It's
Mm-hmm.
healthy, balanced inflammation fights off viruses, it kills bacteria, it heals wounds. So
Mm-hmm.
homeostasis in the body, a healthy, balanced inflammatory response is quite important. It's when
Right.
inflammation is thrown out of balance, that's when problems ensue. It's
Right.
this forest fire burning in perpetuity that's the issue, because
Mm-hmm.
chronic inflammation is this commonality between just about every health problem under the sun. When you look
Yes.
at autoimmune disease, musculoskeletal issues, digestive problems,
Mm-hmm.
cancer, diabetes, heart disease, and autoimmune conditions, and
Absolutely.
even mental health issues. If you look at the epidemic rise of mental health issues like anxiety and depression and fatigue and brain fog and
Mm-hmm.
autism, ADD, ADHD, what does the scientific literature show? There's a whole
Right.
field of research referred to as the cytokine model of cognitive function. Cytokines are pro-inflammatory cells. So it's research looking at how inflammation is impacting how our brains work, how
Mm-hmm.
inflammation is impacting mental health. In the West, we like to separate mental health from physical health. Well, it's
Yeah.
a mental health problem. Well, that's actually not accurate. Mental health is not separate from physical health. Mental health
Mm-hmm.
is physical health. Our
Yep.
brain is part of our body, and you cannot separate this one organ and make it this abstract thing. It is
Mm-hmm.
one and the same. And the old view of mental health in the West was that the brain was immune privileged, that there was no inflammatory components to the brain. And now that's been found to actually not be true at all. The brain has a very
Mm-hmm.
sophisticated immune system, and we have
Mm-hmm.
these things called the microglial cells, which are in balance. Again, a good thing. They help to clean out neurons and help
Right.
prune the brain to be nice and healthy. But microglial cells thrown out of balance is like an assassin. It
Right.
destroys, it's an inflammatory cascade, an inflammatory storm that's linked to things like anxiety and depression and fatigue and brain fog and autoimmune neurological problems. So
Mm-hmm.
that's really the heart of my work of educating people on this,
Yep.
and then empowering them on tools to have agency over their health, which many people are left to fend for themselves with these things. Like, what the heck do I
Mm-hmm.
do? I just take this
Mm-hmm.
pill and see you in 6 months.
Mm-hmm.
I have to live with this. This is my lot in life. And they are left in this abyss of Dr.
Mm-hmm.
Google and
Yeah.
doctor's visits. And it's really my heart and my passion and my mission to really give people hope and give people tools and give people resources that are evidence-based to start having freedom again.
Mm-hmm. And thank you so much for that, Dr. Cole. I mean, I feel your passion, and I know the audience does too. And I resonate with you on that, with just my practice of culinary alchemy, using food and nutrition as well as what I call spiritual nutrition to really find that balance with our physical body as well as our emotional and mind and our energetic bodies
Mm-hmm.
to manage all of that and to kind of heal and live optimally. So I often refer people to your books because I find them to be such a great resource. And
Thank you.
again, I love your passion for that, and I'm so grateful for what you do and what you're doing
Thank you
for
so much.
the
Thank you.
world. Thank you. I run different tests, many of the ones that you've recommended as well for my clients, and I've done this for a long time. But for the people out there that may not have a functional doctor, may not have a nutritionist or a naturopathic doctor, what are some basic tests that they can walk into their current doctor, or maybe, I've recommended some that are online that they can order and self-test, or what are some basic tests that they can start with to gauge where they're at and have a little information?
Yeah, that's a great thing. So a lot of the tests are, like you said, these are not fancy functional medicine labs.
Mm-mm.
A lot of the
Right.
data you can get, any doctor can run them. You just have to
Mm-hmm.
request it, and they have to be
Yep.
okay with running it, which most doctors are, because they are so basic. So
Mm-hmm.
one is high sensitivity C-reactive protein,
Mm-hmm.
HSCRP.
Mm-hmm.
And in functional medicine, we want HSCRP, high sensitivity C-reactive protein, to be under 1. It's an inflammatory marker. We all make low levels of it. That's normal. Remember,
Mm-hmm.
inflammation is a product of our immune system. We want it in healthy, balanced levels. But it's HSCRP thrown out of balance. The American
Mm-hmm.
Heart Association, the CDC, have guidelines for HSCRP to look at low, average, and high relative risk factors for cardiovascular events, heart attack, and strokes. But a lot of things can spike high sensitivity C-reactive protein. So
Mm-hmm.
autoimmune conditions, people that have chronic inflammatory gut issues, people that have
Mm-hmm.
diabetes and metabolic issues, you will see spiked HSCRP. We want it under 1 in functional medicine. Then that's also the AHA's and the CDC's guidelines too. The
Mm-hmm.
number 2 is homocysteine. Homocysteine is an
Mm-hmm.
inflammatory marker. We all make some levels of it. That's
Yep.
okay. But we want homocysteine to be under 7 units. Above 7, there are studies to show in the research that above 7 homocysteine can increase blood-brain barrier permeability, or
Mm-hmm.
it's connected to neuroinflammation, that brain inflammation
Mm-hmm.
that I mentioned earlier. It's also
Mm-hmm.
been shown to act as a neurotoxin and be actually toxic to the brain.
Mm-hmm.
And
Right.
it's associated with something called leaky brain syndrome. As somebody with leaky
Yes.
gut syndrome, which people have heard of, uh,
Yes.
homocysteine in higher levels can do the same thing for the brain, which is
Right.
associated with that neuroinflammation and the microglial cells, the neuroinflammatory problems. Above 10.4 or so, depending on the lab that you're looking at, is typically the lab's reference range for homocysteine. It's associated with heart attack and stroke and those sort of cardiovascular inflammatory. And that's typically why people are running homocysteine in the conventional setting. But in functional medicine, we just don't want the lab's reference range, that's a bigger discussion, I guess. But the lab's reference range on your labs from your doctors are largely going to be based on a statistical bell curve average of people who go to labs. People that go to labs, sadly, aren't the healthiest bunch of people. So just because you're normal within the lab's reference range doesn't mean you're actually optimally healthy. So homocysteine is a wonderful example of that, because you could have a normal homocysteine but still be outside of the optimal, healthy, functional range. That's where functional medicine gets its name. Where is your body functioning the best? And just because something's common doesn't necessarily mean it's normal. Just because something's ubiquitous doesn't necessarily mean it's optimal for you.
Exactly.
So in functional medicine, we want you to be optimal. We want you to feel optimal. So the Institute for Functional Medicine, that functional medicine doctors like myself, we're looking at vibrant wellness. Where does that reside? And that's where we want you to get to. So for homocysteine, we went under 7. And then ferritin is another interesting biomarker that's very basic. It is a biomarker to gauge for stored iron, but in high levels, it can act, or it can be a significant biomarker to gauge as an acute phase reactance. Basically, in states of inflammation, you could see ferritin spike. You always want to put that in context with the other iron biomarkers like iron and iron saturation, total iron binding capacity, to kind of see and make sure it's not iron overload or hemochromatosis or something like that. But many people are in states of inflammation. You will see spiked ferritin levels, which is, again, homocysteine, HSCRP, and ferritin, 3 good labs, simple labs that you can ask your doctor to run. And then in functional medicine, we get a little bit nerdier and deeper as far as like the gut labs and the methylation and all the other things. But those are some basic tests people to dig into.
Thank you for sharing that. And that's a good place to start for anyone that doesn't know where to begin. And I'm a functional nutritionist. I do integrative and functional nutrition. So even if you don't have a doctor like Dr. Wilcole, he does obviously virtual sessions. You can at least take those labs to someone who does integrative and functional nutrition, and they can still help guide you through your diet. So, and talking about diet, Will, you have 2 amazing books. We've already had some comments come in about how people love your recipes. Can you share a little bit? I know that Ketotarian was the first one, but just for the people who aren't familiar with it and what that means, what you mean by Ketotarian, I would love for you to talk a little bit about your 2 books.
Sure, thank you. So Ketotarian was my first book. It's a mostly plant-based ketogenic way of eating. And then my second book is the inflammation spectrum. Real fast on the inflammation spectrum, at the beginning of that book, there's a quiz. And that quiz, it's the inflammation spectrum quiz. I adapted that from questions that I asked patients. So we're talking about labs, inflammation labs. If you don't get labs from your doctor or a functional medicine doctor or nutritionist, then I would suggest taking that quiz to kind of see from an assessment standpoint, subjectively, where are your inflammation levels at? That's one way to gauge it too, because I've seen, it's interesting because my focus is on a clinical level. So I'm used to managing in the cases and making sure like everyone's on task and making sure they're achieving their goals and retesting labs, blah, blah, blah. But it's interesting to see on social media, people doing this stuff on their own, and they're taking the quiz in the book at the beginning. And then after like 60 days and seeing that quiz score drop so dramatically, meaning their inflammation levels have calmed. It's really cool. It's not a lab, but it's the next best thing. Is to like gauge like where, and that quiz is also free at drwilcole.com. So if people just want to go to the site, they could just go to inflammation spectrum. The quiz that's in the book is on the site if people want to take that. But all right, so the sorry, I forgot the question. Oh, the books. Yeah. So the books. So Ketotarian was my first book, and it is a clean ketogenic diet. So it evolved from my own health journey. I was a plant-based eater. for a
Mm-hmm.
long time, 10 years.
Mm-hmm.
And that evolved to a ketotarian way of eating. So it's still a
Mm-hmm.
mostly plant-based, clean ketogenic or clean keto diet. And I don't advocate, and you'll see when you read the book, that I don't advocate
Mm-hmm.
for everybody to be in ketosis all the time. But
Right.
I recommend actually to do it initially for 60 days.
Mm-hmm.
Why? It's to get the benefits of ketosis. It's
Right.
to gain metabolic flexibility. Most people are only stuck in this sugar burning mode. It's like
Mm-hmm.
kindling on a fire. What happens
Mm-hmm.
with kindling on a fire? You get a little flame and then you put more kindling on and then you put more kindling on, or you're going to get hangry. You're going to get
Mm-hmm.
irritable. You're going to be on the blood sugar roller coaster. You're going to be
Yep.
fatigued and you're going to be have insatiable cravings. That
Yep.
is an option if you're on kindling burning mode. But the
Yeah.
alternative from a metabolic standpoint is putting a log on the fire. And that's what being keto adapted or fat adapted is. It's metabolic flexibility. So there's a time and a place to burn kindling and to
Kindling.
burn firewood. You
Yeah.
can burn sugar when you want to, but you have the
Mm-hmm.
option to burn fat, our own fat, as well
Mm-hmm.
as fat for fuel in the form of our food. So
Mm-hmm.
that's what the ketogenic diet is. It's a fasting mimicking way of eating. It elicits a lot
Mm-hmm.
of the same mechanisms that intermittent fasting, which I talk about in the book, but your body can do that while eating food. You can eat
Mm-hmm.
until you're satiated. You can eat nutrient dense, filling, delicious food and mimic the benefits of fasting, which
Mm-hmm.
are, what is it? Your body's producing beta hydroxybutyrate, which is the main ketone, and your
Yeah.
body can use that to burn fat. It
Mm-hmm.
passes through the blood brain barrier, so it enables your body to get really clean, sharp brain function.
Mm-hmm.
And it acts as a signaling molecule,
Mm-hmm.
meaning it does really cool things for your health. So beta
Mm-hmm.
hydroxybutyrate can calm down inflammation, like the NF
Mm-hmm.
kappa B pathway, COX2 pathway, the NLRP3 inflammasome, basically all these pro-inflammatory cytokines. Beta
Mm-hmm.
hydroxybutyrate calms that inflammation naturally. Think of it as a natural anti-inflammatory drug, but your
Mm-hmm.
body endogenously makes that on its own, which is really cool.
Right.
And it improves mitochondrial function, which is cellular
Yep.
energy. It improves mitochondrial biogenesis.
Yep.
Basically, I could go on and on. It does a lot of cool
Yeah.
things for your body. But I
Yeah.
want you to do that in a clean way, in a sustainable
Mm-hmm.
way, in a practical way. And that's what
Mm-hmm.
ketotarian is. It's my made up word of a mostly plant-based amalgamation. You mentioned like alchemy, right? It's this
Mm-hmm.
alchemy of the best of being plant-based and the best of being keto adapted. So it's
Mm-hmm.
vegan keto, vegetarian keto, and pescatarian keto.
Mm-hmm.
Basically, wild caught fish, fresh seafood, but still predominantly plant centric. I call it vegetarian in the book. So there's all of these like clean ways of going keto. But after you do 60 days, you've got some metabolic flexibility. Then you could
Mm-hmm.
experiment with this tool of ketosis because you gain more metabolic flexibility.
Right.
Then you can do a cyclical ketotarian, which is what I advocate for most people. You could
Yes.
do good 3 to 4 days in ketosis, then you increase your clean carbohydrates. And what does that look like? That's under 55 grams of carbohydrates, net carbs, which I talk about
Mm-hmm.
that in the book, The Science of That. But basically, under 55 grams of net carbs when you're in ketosis, and then you go to 75 to 150 grams of carbohydrates when you're out of ketosis.
Mm-hmm.
Still not a high carb diet, but you're just moderating your carbohydrates.
Right.
But you can go in and out. You can burn fat, you can burn sugar, you can burn a log, you can burn kindling, but you have the flexibility to do both. Clean carbohydrates are things like fruits
Mm-hmm.
and starchy vegetables like sweet potatoes
Mm-hmm.
or rice. So you can go in and out of ketosis, and that's what I like. There's a grace, there's a lightness, there's a balance to that. And that's what I really talk about, the science and the practical. Like half of the book is recipes and pretty pictures and meal plans and all that stuff. So that's what
Mm-hmm.
Ketotarian is. I'm very proud of that book because I feel like it was it's a paradigm shifter for a lot of people. And then the inflammation spectrum is just a deep dive in the concept of inflammation, and then talking about that quiz, and then how do you really go beyond ketosis? What are some other food ways and what are some non-food ways? So it's not just about food. We talk about stress, we talk about sleep, we talk about toxicity, we talk about chronic infections, we talk about social media and screen time and all those other things. because you could be eating super clean, but if you're serving your body a big slice of stress every day, or
Sure.
endless scrolling of FOMO inducing content on social
Yeah.
media,
Or just
you're going
media.
or yeah, the news 24-hour news cycle,
Yeah.
all that stuff is raising inflammation levels too. So this isn't
Mm-hmm.
to stress everybody out and say, what the heck, I know I'm stressed about not stressing. It's not about
Mm-hmm.
that. I just want
Yeah.
you to have tools to start moving the needle in the positive direction.
Yeah, no, and that's such a great sum up of your books. And we already have people that from Brazil, as far as Brazil and Italy and different places that said they have bought your book. So that's wonderful. Thank you guys for sharing that. What I really love your adaptive approach with the ketotarian, because I've had a lot of clients ask me about that, and I agree that 60 days and then you kind of cycle, because you put your body into that state. You have some of these benefits, but not to take it much further than that. There was a question that popped up, and it pops up quite often actually with clients, is why can't I just do this as as my normal diet, and just be in ketosis all the time? And it's not healthy. And I would love for you to kind of dive into why it's better to cycle that.
Yeah, so I put some categories in Ketotarian for people to kind of see, at least from a clinical standpoint, what I typically
Mm-hmm.
see. Because there are
Mm-hmm.
certain categories of people that I find tend to do better with longer term ketosis. So
Right.
the people that have to lose, a significant amount of weight, they tend to do
Mm-hmm.
better with longer term ketosis.
Longer.
Yeah,
Mm-hmm.
not forever ketosis necessarily,
No.
but until they get to their goals. If
Sure.
people have neurological problems like
Mm-hmm.
seizure disorders, if they have
Mm-hmm.
neurological autoimmune issues, like a lot of times with MS and
Mm-hmm.
Parkinson's, and to people in the autism spectrum disorder community,
Mm-hmm.
Asperger's, the neurological, neuroprotective, the metabolic benefits of ketosis, those people could still experiment with moderating their carbohydrates. This is
Mm-hmm.
about grace and lightness again, guys. This isn't
Right.
about making broad sweeping, generalized, dogmatic
Right.
statements. This is saying these are tools. Let's find out how these tools work best for your life.
Mm-hmm.
So I still advocate for those people. They could experiment with moderating their carbohydrates, but see
Mm-hmm.
how you feel. How's your
Mm-hmm.
energy? How are your symptoms? How's your weight goals?
Mm-hmm.
How's your digestion? How's your sleep? These things are all things you can check in with your body. But what I
Mm-hmm.
find is that those people tend to do better with longer term ketosis, and they're using the mechanism, the tool of beta hydroxybutyrate ketones to
Mm-hmm.
maintain their symptoms. They're using that tool as a way to manage their life. But
Mm-hmm.
many people, women, a lot of men, people that don't have to lose weight,
Right.
people that have hormonal
Yeah.
imbalances, tend to do better with a cyclical ketotarian approach.
Yeah.
They go ketosis, then moderate the carbs. Ketosis. And look, from an ancestral health perspective, if you're looking at it from like an evolutionary standpoint, that
Mm-hmm.
humans would have eaten seasonally or cyclically based on food availability. And
Right.
that's what our genetics have adapted to. So research estimates that 99% of our genetics haven't changed in 10,000 years. So
Right.
there's a time for ketosis and a time for carbohydrates. There's a
Mm-hmm.
time for eating. There's a time for fasting. The problem is
Mm-hmm.
as a society, we're always in feast mode, and
Yeah.
we're always in sugar burning mode, and
Yeah.
we're eating actually famine foods in a feast time.
Yeah.
For example, grains were used primarily because they stored well, and
Mm-hmm.
they would been good during times of scarcity and famine.
Right.
But
Mm-hmm.
we're eating famine foods in a feast time all the time. So I'm just saying,
Right.
let's get back to our ancestral roots from a metabolic standpoint. Just tap into what our genetics have been adapted to over eons.
Right. And I'm so glad that you made that point. And I agree, you really have to, and it's something I teach as well, you really have to listen and be in tune with your body and pay attention. There is no one size fit all. There is no solution that works for you. I mean, it may work for you for a certain period of time. That's why the cyclical method works. But, our bodies are always evolving and changing. Our environment is as well. And so you really do have to pay attention and flow with it. And it's a good reminder for people that it's not like, okay, this is the one thing that's going to work for me
Right.
forever. And then think that it doesn't work if all you need to do is just modify a little bit.
Exactly. Well said.
Okay, so would you mind diving into some questions, because we have
Sure.
pages of questions. We won't probably get
Yeah.
through all of them, but we'll at least get through a few. So let's see. We have several questions on autoimmune and Hashimoto's and thyroid. So one is the biggest tips for someone who is just diagnosed with Hashimoto's and is experiencing hair loss. So at least we can at least start with the first part of that question. As someone who's
Mm-hmm.
just been diagnosed with Hashimoto's, what are some things that they can do immediately? And I know that it's sort of individualized, of course, but
Mm-hmm.
if there's any general tips.
Yeah. Well, for people that don't know, Hashimoto's is the most common autoimmune disease. It's the first autoimmune disease ever discovered in science, actually. The guy, last name was Hashimoto in Japan. And he basically, people like to name autoimmune diseases after themselves. I would not want an autoimmune disease named after me. But I think
Agreed.
like Sjogren's and Hashimoto's
Right, yeah.
and Addison's and all these guys like to have their names attached to diseases. But if that's your thing, I guess go for it. But anyway, autoimmune thyroiditis is when the immune system's attacking the thyroid. And we measure that in functional medicine by running thyroid antibodies. So we run these labs for people around the world, as I'm sure you do as well. And your doctor can run these too. These are basic labs. So thyroid peroxidase antibody, TPO, thyroid globulin antibody, TGAB, and even Graves' disease. You can run that because people can have more than one autoimmune disease. So TSI, or thyroid stimulating immunoglobulin, because people with Hashimoto's can have times of thyroid storm, of hyperactive thyroid, and they can have hypo. So sometimes people have Graves and Hashimoto's together, and you only know that if you run the thyroid antibodies. Your doctor doesn't typically run those labs unless you ask for them, because it's superfluous from their standpoint. The end result's still going to be that thyroid replacement hormone like levothyroxine, Synthroid, or something like it.
Yeah.
So from a mainstream conventional standpoint, it's superfluous. But from like, if it's not going to change the treatment, let's just run the basic TSH and T4 and give you the Synthroid. But from a functional medicine standpoint, from a functional nutrition standpoint, we want to know the mechanisms at play here. So if it's an autoimmune thyroid problem like Hashimoto's, it's addressed and understood completely differently if it's an underconversion of T4 to T3, or if it's thyroid resistance with a high reverse T3. There's so many thyroid problems that go missed because you're not getting the full picture of your thyroid. You just need to run the full thyroid panel. It's just, I talk about this at length at drwillcole.com. You just type in thyroid labs. You can print off the labs that you should ask your doctor to run, or ask one of us to run them, and the interpretation of the labs. It's not just the labs reference range. You want to look at the optimal functional range there. So the question is, what can you do if your hair is falling out? Well, you have to look at where your hormones are at. So you have to see, where's your T3 levels? Where are your T4 levels? Are you in active thyroid storm? And then beyond the thyroid, what else is going on? Look at your selenium and iodine levels. Look at your gut health. Look at your female hormones. Look at testosterone levels. There's so many things beyond the thyroid, but also interact with the thyroid, because it's a symphony of hormonal dances that happen as well as the liver and the gut, that are quite important to understand the full symphony, not just one player. Even though the thyroid's a major player, it's not the only player in your body that's determining hair loss. So you have to look at all of these variables to see what's driving your hair loss. Because in functional medicine, we would see hair loss as the check engine light. We know the check engine light's on the car, but we want to look underneath the hood, proverbially speaking, and see why. Because you could have 100 people with hair loss, and what's driving it for one person is not driving it for the next person. So it's really important to realize that the hair loss, or the fatigue, or the weight gain, or the anxiety, or the inflammatory symptom, those are just check engine lights. You can't treat everybody with the same protocol with a check engine light as your only indicator. You want to look what's going on underneath the surface that's causing that check engine light to be in the first place. So I know that it's not like a nice answer like hair loss, take this, but you really have to do it. Is it an iron deficiency? Is it underconversion? Is it a nutrient deficiency like selenium? There's so many possibilities that it could be a confluence of more than one factor. So that's not the sexy answer, but it's the real answer for dealing with these things.
And I really appreciate you really breaking that down and explaining that, sexy or not, because people don't seem to understand that it's not just like, okay, take these 4 supplements and your hair will stop falling out, or your vitiligo may go away, or your eczema may go away. You really kind of have to deep dive, and there's multiple layers, and finding, I think, the right practitioner or nutritionist that can really take all the information and put it all together and see what is the missing puzzle piece is one of the most important things for people to kind of resolve their problem.
Totally. I agree.
People are asking about CBD, and how you feel about that for inflammation, for stress relief, for some of these check engine like issues. And I know that it seems funny that I'm saying that there's no one solution, but do you think that's something that could be helpful?
Yeah, I do. I think it's a tool without knowing someone's underneath their hood variables. CBD is a great modulator of the endocannabinoid system, the ECS. So yeah, it's a tool to experiment with. Does that mean it works for everybody? No. It could do nothing for you, meaning that you're not noticing any changes, or you could not feel good on it. That's rare, but it does happen, especially for people that have more sensitive systems or a more, imbalanced endocannabinoid system. But the ECS is needed for healthy modulation of inflammation, healthy modulation of brain function, healthy modulation of stress response. It is imperative and paramount to have a healthy endocannabinoid system. One way to support that is CBD oil. It's just a matter of getting reputable sources.
Yes.
There's so much. I mean, every week I have a CBD company approaching us and saying, will you endorse our product?
Me too. It's like constant.
It's like, I love the free market. And I think it's wonderful you have entrepreneurial people getting information out there, but there's a lot of chatter and noise online when it comes to CBD oil. So make sure you're getting organic sourced CBD, making sure that it's third-party tested, make sure that it's verifiable and it's traceable as far as where they're getting it. Basically, from seed to shelf, you should know transparency, what you're getting with CBD oil, and a lot of other things too. But specifically CBD, because there's so much competition there. And then third, make sure that it's coming, like, there's people in the space that are actually like supporting it and it's coming reputable, enough of a backing, that you're getting some medical professionals or getting some scientific professionals that are backing that. I think that's important as well. And then the other thing with CBD is make sure that you're dosing appropriately. Look, you don't want to overdose a CBD. You don't want to like take too much, but you don't want to be not taking enough either. So a lot of times people are like, well, it doesn't work for me. Well, maybe they're not dosing high enough for their specific issue. So you have to find a therapeutic dosage that works for you. So start off low, start off slow, but work your way up within the realm of what the company that you're using recommends to really see how it's working. And you have to be consistent with it. You can't just take it once and be like, it doesn't work for me. It builds up. It's liposomal, so it builds up in our body over time. Some people do see pretty quick results from it, especially how like vape pens tend to work faster than like an oral oil. But regardless, you have to give it time to actually do its job.
And thank you for that. I think that was really, really strong, informative points, you guys. It's just, you have to know the sourcing. You have to be doing the right dosage. This has to be something that's reputable, trusted sources. And, most importantly, you have to stick to any program you decide to go with, whatever it is, whether it's dietary changes, supplement, whatever it is, you have to stick to it for some period of time to see whether or not it's effective for you. So don't give up after like 1 try, 2 weeks. That being said, we have a few people that have rheumatoid arthritis. And then one person, she's a mom of 3 young kids, and it seems like she's doing everything right, so to speak. She exercises regularly. She's gluten-free, dairy-free, everything is organic, pasture-raised. If she's doing animal protein, very low sugar. She does do alcohol occasionally, human. And she's also off. She doesn't want to do any type of prescription medication. She's off of that now. But it seems like when the winter months come, it's especially challenging. Is there anything that you can recommend, or at least a direction that she can go in to help kind of prepare and offset what seems to be something that comes regularly for her?
Mm-hmm. That's good. And that's a lot of good information too to help be more specific with my recommendation. So I
Mm-hmm.
think that labs are a good starting point for these type of case. Anybody that's diagnosed with an autoimmune disease, I think would behoove them to look into labs to look at the variables. What are the multiple labs perspective from their vantage point, what's going on? So
Mm-hmm.
looking at the gut specifically, there are certain colony forming units of bacteria, of dysbiosis and overgrowth that are associated with triggering and perpetuating rheumatoid arthritis.
Mm-hmm.
Obviously, intestinal permeability or leaky gut syndrome, which is also associated with rheumatoid arthritis.
Mm-hmm.
Lipopolysaccharides and gram-negative bacteria. These are bacterial
Mm-hmm.
endotoxins that can pass through the gut lining. That LPS-induced inflammation is also associated with rheumatoid arthritis. So looking
Mm-hmm.
at gut health in a bigger, broader way beyond just eating clean, really giving it the
Mm-hmm.
full due diligence that it deserves, the full time, the
Mm-hmm.
full thoughtfulness that it deserves.
Mm-hmm.
And looking at beyond eating clean, there can be healthy foods that work for somebody else that may not be right for your body,
Right.
especially with autoimmunity. You could have foods that drive inflammation. Good example, nightshades.
Yeah.
Probably a lot of your audience knows about them already, but they're plant groups that a lot of
Mm-hmm.
people still keep them in because they are healthy foods. But just
Mm-hmm.
because something's healthy doesn't necessarily mean it's optimal for you. So
For your body, yes.
for your body, it's
Mm-hmm.
bioindividuality. That's what I'm
Mm-hmm.
exploring in obviously my clinic, but also in the inflammation spectrum in my book. It's that
Mm-hmm.
I do fine with some nightshades, but I know some nightshades spike inflammation in me. So
Yeah.
nightshades are plant groups that include peppers, tomatoes, eggplants, goji berries, white potatoes.
Mm-hmm.
Many of my patients do fine with nightshades. I'm not making a
Mm-hmm.
blanket statement against nightshades, but
Right.
we talked about the endocannabinoid system there with CBD oil. Well, the ECS, the endocannabinoid system, your gut, your microbiome, gastrointestinal system is
Mm-hmm.
rich with CB1 receptors. Those are endocannabinoid receptors. And there are
Mm-hmm.
gene variants to the ECS, the CB1 receptors that are associated with higher reactivity to things like
Right.
alkaloids, which are in
Mm-hmm.
nightshades, and
Mm-hmm.
lectins, which are in nightshades and nuts and seeds and legumes. So look at
Mm-hmm.
these foods that are healthy, but may not be
Mm-hmm.
healthy for you in a reactive system. It could be stressing out an already stressed out system. So I
Right.
talk about those gene variants in the inflammation spectrum. You can check that out. But, and then the other thing is she mentioned her symptoms getting worse in the winter. So she could move to
Mm-hmm.
Miami or move to Los
Mm-hmm.
Angeles and not have winter. So that could be doctor's orders. Or she could get like a light therapy, like a Juve light, or
Mm-hmm.
get some sort of red light therapy, an incandescent light therapy, or a sauna or something where you're getting light
Yeah.
and heat therapy
Yeah.
to manage your symptoms that way too. So
Yeah.
those are some ideas.
I would agree with that. Actually, it's a great recommendation. I love having infrared light therapy. I don't have winter Newport. That's true. But you could get a light therapy thing. You could go to Juve, or you can go to one of these wellness centers, or I have a Juve in my house. And that's really helpful for inflammation as well.
I was married in Newport Beach, Corona del Mar, actually. Yeah.
I swear,
Yes.
I love Newport
Yes.
Beach. Well, I mean, I'm in
Yes.
Santa Monica. I kind of love the side of the coast. That's a great recommendation. And I kind of wanted to. I lost my train of thought. I wanted to say something about what you were saying. Oh, just about how you really, again, like everyone's body is really different. So that's why extensive intake forms and going to Dr. Will's website, Dr. Cole's website, and checking out his tests. And it's very similar to what I do, where I run these labs, but then I do a very extensive intake form, which seems so superfluous to a lot of my clients. There's a million questions, but it gives me insight to what is going on with their bodies from a physical and from an energetic point of view, like where the blockages may be in their energy centers that result in a physical way. And then that means we run some more labs just to get, like you said, real nerdy from a functional perspective.
Yeah.
Some people asked about water. Like, there's two questions. I'm just going to throw them out there because we're coming close to time. But water quality, how important this is in your opinion. And then also, is keto good for PCOS and PCOD? There's obviously a ton of other questions, but let's tackle those couple.
Yeah. So water supply, definitely important. What happens in Flint, Michigan is happening in various degrees all around the United States and around the world. So you definitely need to look at your local municipality. There are definitely different environmental and water safety organizations that provide a database where you just type in your zip code and you can look at where are your what's your local municipality? Are there any known abnormal levels of toxicity in your local area? And then also look at have your home water tested too, because it's not just about the municipality or the local county. It's about your actual pipes and local like home structure itself. So you should have a home water test done too. And then based on those results, you can get a proper filter based on what's specific to your area. Meaning if you have higher, if you have higher levels of like some specific heavy metal, you don't want a filter that's filtering things that aren't even there. You want something that's doing actually something for you, not just this broad sweeping filter that may or may not be helping you. So I think, yeah, it's a little bit more arduous, but it's not that big of a deal. And it's for a long term. You do it once and pretty much you can stick with that. And then, but if you go to drwillcole.com, just type in water filter. I wrote a whole article on the site with like links for different filters and economical ones, more expensive ones. You can, and I don't make anything off of those. There's links to like Amazon things that you can get,
Wow, that's great information. I didn't even know that. I'm going to actually go to your site and check out the links as well.
And PCOS. I didn't answer the PCOS question. Sorry. Absolutely. There's so many cool studies looking at polycystic ovarian syndrome and ketosis. Absolutely. It's one of the most, as far as female hormonal things, it's one of the most well-researched aspects of this modality, this tool of using beta hydroxybutyrate ketone, becoming and getting in ketosis for the management and support of healthy female hormone balance related to PCOS. PCOS is driven by insulin resistance in most cases. So to manage insulin resistance, that's a great way to do that.
That's great. And so I think that answered a couple of people's questions, because we had a few that had to do with thyroid autoimmune disorders relating to the thyroid, PCOS, PCOD. Someone had asked about how to properly do an elimination diet. And of course, every practitioner kind of has their way. There's always the basic foods to cut out. They're saying what foods to cut out, obviously sugar, anything processed, dairy, gluten. But they want to know for how long, and I think that that's individualized, but I'd love your recommendation on that.
Sure. Question. Well, I mean, there's so many ways to do an elimination diet. I have probably, I don't know, there's so many even variables under the 15 that I can think of. There's even variables amongst that based off of someone's health history. So with that said, clinical practice, you can get a lot more nitty gritty as far as the specifics. But in lieu of that, that's what the inflammation spectrum, the book's all about. So there's the core 4 plan and then the eliminate plan based on the quiz score in the book. So your core 4 plan, it's 4 weeks, 4 foods, and those are grains, dairy, added sugar, and industrial seed oils like canola oil, vegetable oil. They are disruptors of the microbiome, of the gut health, and they're drivers of inflammation for a lot of people. But we are bio-individualities. We talk about the nuances of those foods. We all have different thresholds or tolerances. So instead of me indicting those 4 foods and saying they're bad for all people, nobody should be eating them, I want to ask the question, I want you to do your own experiment for yourself and have your own N of 1 experiment to say, what does your body love? What does your body hate? Instead of having some guy you've never met tell you what's good and bad, I want you to find out what's right for your body and have agency over your health. So that's the core 4 plan. And then the eliminate plan is 8 foods for 8 weeks. Those are people that scored higher on the inflammation spectrum quiz, which again, the quiz is just adapted from questions that I ask patients. So that's what I do clinically. It's the core 4 plus 4 or more, or 8, eliminate. It's a play on words. So if you need any pun on words, I'm your guy. So core 4, eliminate. So it's core 4 plus nightshades, which we talked about, legumes, nuts and seeds, and eggs. Those are all healthy foods. And a lot of those work for me, but some of them don't. And you may find, the person that's listening to this, you may find, hey, I do fine with 6 of those, but not with 2 of those. I do fine with 4, but not with 4. But by knowing the foods that are your specific triggers, what are the foods your body doesn't love? By removing those, you can downregulate inflammation and start feeling amazing. And that's what I want people to find out for themselves.
So you guys, I mean, we're not quite done yet, but just, and before we get to the end, I just want to remind you guys that Dr. Will Cole's website is an incredible resource, and his books are just, I mean, if anybody having inflammation problems, which I know there are a lot of us out there are, any type of autoimmune issues, I mean, these books will be your Bible. So go check out his book. It's really, it's done in such a way that you can self-manage, you can do it on your own, which is what his goal is for you, that you can have your practitioners that can help you, but the idea is to have something that you have in your hand that can help guide you through, like what he said, give you agency of your body. We have another question that I thought was really interesting. I'd love for your feedback on it. It's the relationship between genetics and epigenetics. How much, in your opinion, do you think our genetics determine our health?
That's a great study. So, it's a great topic with some interesting studies. So there's a few studies, the Okinawa study, Danish twin study. There's other epigenetic studies looking at, when you're looking at inflammatory problems, you're going to see different numbers based on the study, but anywhere between 75 to 91% of how long we live is determined not by genetics, but by epigenetics. So these are the lifestyle things that are constantly and brilliantly and dynamically influencing genetic expression. So the foods you're eating or the foods you're not eating, your stress levels or not stress levels, your exposure to toxins or not exposure to toxins, your sleep, your physical activity, all of these things are brilliantly and fluidly influencing genetic expression. So that's a lot. That's the majority. Let's just say 75 to 91%, depending on the study that you look at. The 25 to 9% is due to genetics. But genetics is not this immutable predestination over your life. It is not that. It's not the hand of God. It is a light switch that is being turned on and turned off by genetic expression, by epigenetics, by the lifestyle stuff. So it's genetic expression, and downregulating and upregulating genetic expression is what epigenetics does. So that is really what the data is pointing to. I reference these studies with the links to PubMed on in the inflammation spectrum and on the site, so you can see what I'm talking about. But this is really again, this message of health responsibility, of health. I keep using the word agency over your health. Having equipping you with the tools you need to say, look, just because my mom had something or my dad had something doesn't mean I'm going to have something. Because I guarantee you, we have a couple hundred, obviously, in a week, like after this video is playing, there'll be a couple thousand people watching this video. The old view of it was that, my mom had something and my dad something. We thought like there was nothing we could do. But the reality is, what we were told growing up isn't true for the majority of the human race. So we know better, and when you know better, you do better, hopefully.
Exactly. And I'm so glad you said that. I mean, both my parents had cancer. My dad passed from it. My mom is still with us. And I firmly agree with what you're saying. It's just that you have tools and your genetics play a certain part. But again, it's a switch. And there's so much with our lives and so many things that we're empowered to change and take responsibility for our health as well. So I think that answers some of the other questions that came in just about thyroid antibodies, and again, genetics, mothers, grandmothers, aunts who have thyroid disease. Does that mean that you're going to get them? Not necessarily, but they are, you have an awareness and you can run some of these basic labs to start. I would say take a look at Dr. Will Cole's website, his books, and just kind of give yourself these tools so that you know what direction to go in and find a practitioner that can help guide you. So we're coming up to the end of this hour. This has been so informative. Well, I appreciate you so much for taking the time. Before we wrap up, can you just let everyone know where they can find everything? I mean, we talked about your books and your website, but please share with everyone your socials. And I'm not sure if he also has a podcast with Goodfellas, but just tell us where we can find you everywhere.
Yeah, thanks. And I saw someone ask, "Can I get the book in the UK?" Yeah, it's in the UK market. You can get it online. It's in Korean. It's in like lots of different languages. So you can look at in different languages too. Yeah. So everything's at drwillcole.com. You can get the links to the book there too. So it's drwillcole.com, drwillcole.com. And there's links for a free health evaluation. We offer consultation via webcam. So you can check that out. And there's tons of free content. There's video classes, there's articles, like hundreds of articles I've written over the years. So there's a lot of resources on there that are free as well. And on Instagram, it's at Dr. Will Cole, DRWILCOLE. Same with Twitter, Facebook, but I'm most active on Facebook and Instagram.
Okay, perfect. So you guys go follow. If you don't already, I'm sure lots of you do, but if you don't already, go follow Dr. Will Cole. He's just a genius, and really one of the go-to experts that you want to learn from when it comes to information and gut health, all of this. And if you have any other questions for me, definitely message me. You guys, my text message, my number to text me is on my profile, 310-317-7852, and we'll make all these replays available. Go join my private Facebook group. And Dr. Cole, is there anything else that you want to add? I mean, we could literally have you on for hours. I'm still having my text messages. I'm sorry, guys, I can't get to all of them. Are blowing up.
Cool.
We would love
to do it again.
Time.
We have to do it again. Yeah, let's do it again. We'll do part 2. People
That'd be awesome.
Get their questions ready. Yeah, I'm very thankful for you having me on this, and I'm glad we can connect again. And when the world is put back together, we have to connect in person.
Yes, I can't wait. I would love to. I mean, we're getting there. This is just kind of this moment in time. It's what I'm telling people. Just know that this will all pass, and things will get better. So just know that this is a moment in time. It's not forever. So I can't wait to see you when that time comes. So thank you so much, Will.
Yes.
I'll talk to you soon. People are like, please come back. We'll have him back, promise.
We'll be back.
Okay.
Bye.
All right.